Today, we're going to go behind the scenes with Mitch, a clinical apheresis nurse at MDLifespan. So he's leading the charge out in Florida, where he's delivering firsthand the cutting-edge therapeutic plasma exchange treatments to a bunch of patients. So he's going to walk us through a real patient journey, like as if we were going to walk into the office, and he's going to step us through the process from the first session to the sessions that follow, and share some of the life-changing results he's also seeing every single day. So if you're curious, let's dive in. All right, Mitch, we're doing this. It's so glad. I'm glad to have you here as someone who is running the first clinic, right, for TPE in Florida for MDLifespan. I'm super curious to hear your perspectives and insights and all that. So thanks for joining me today.
No, definitely. Thank you for having me, Joe. I really appreciate it.
Yeah, man. So I'm always curious, like, how did you get into this whole field? Like, what was the turning point, or maybe some aha moment that you might have experienced?
Yeah, I mean, like most nurses, started out as a baby nurse, worked in the ER for a few years, tried everything, education, management, precepted some students. Actually where I learned, well, I'll get into in a minute, is the ultrasound IV skill, was down here in Florida after I graduated. And that kind of followed me into travel nursing. I did a little bit of travel nursing in the emergency department, really opened my eyes to different types of populations, different types of individuals, all different walks of life and everything. And then from there, again, they wanted me for my ultrasound IV skills, so I would go around, do ultrasounds there. Got to a point where I just wanted to focus on that. Went to pediatric PIC nursing, actually, complete departure from when I was before. Still seeing a lot of sick kids, and we'll touch on this, but they also seem sicker than from before, even years before when I started. Then from there, I just wanted another change. I really delve into my ultrasound IV skills, and that's actually what elicited me for a job find. And I stumbled across MDLifespan, stumbled across Dr. Savage. From there, I just went through the interview process, met Dr. Savage, knew immediately like this was something I wanted to do. He's so enthusiastic about toxins and fairly something I've never really heard of or worked with, which is TPE, Therapeutic
Yeah.
Plasma Exchange. And at first, I was like, oh, it's probably just, another procedure, anything that's going on. But as the kids say, he brought the receipts. So he showed me, hey, this is what it works with. And one of the things that really resonated with me coming from a physician, a colleague, is I respect what you do. And that's something that's really paramount, I think, for all nurses. But kind of starting the TPE journey, going up to Chicago, learning the machines, learning that it's taking out these toxins, and doing my own research on the side, figuring out we're surrounded by them. I mean, there's toxins in almost everything that we have. There's toxins in the shirt I'm wearing,
Yeah.
dry cleaning even, and going back into the conventional hospital and thinking like, they don't really talk about this. They'll talk about pesticides, the more
Yep.
bigger, I guess, toxins that they think about. But man, they don't talk about like PFAs, forever chemicals. They don't talk about, triclosans, phenols, all these other things that we're always in contact with that cause the inflammation and cause the things that I've seen in the ER, or cause the things that I've seen putting in a PIC in one of these children or one of these adults.
Yeah.
So really working with Dr. Savage, learning more about it, and coming up with this procedure, this plasma exchange protocols that is all encompassing to help get rid of those toxins and improve either longevity, immunity, and really just a person as a whole. And as a nurse, that's what I signed up to do. It's to help
Yeah.
people. And it's been a great journey so far. About 6 months. I work with a great doctor down here that works with Dr. Savage, and I mean it's been going strong. I've been enjoying it.
That's great. It's so interesting to hear your background going from a travel nurse, working in ER and all that stuff. So you're seeing a lot of symptoms, right? And then now
Yeah,
you're almost like on the completely other side of the spectrum, where
yeah,
you're at the root of the issues. I mean, you're trying to get that out with TPE, right?
yeah. And I'm glad you brought that up. In conventional medicine, we were treating a symptom. Really, you come in, I'm having an asthma exacerbation. Okay, here's an inhaler and X, Y, and Z. Okay, cool. It's fixed. Goodbye. There's other diseases that toxins do cause, or they can create more of a problem with and exacerbate more. Alzheimer's being a big one. We talked about on the podcast, I'm sure a lot,
I don't
the
know.
AMBAR study, which really pushed this forward. But other diseases, autoimmune diseases, even down to rheumatoid arthritis. I even have people who have long-term COVID who are coming to see me, and I have one patient I actually did this week who their smell is getting better. They haven't had smell since they had COVID. So really seeing that we're treating the cause rather than just a symptom is really telling. And as we continue to do research and as we continue to support these patients, seeing how well and better that they are getting, again, not just as symptomatically, but as a whole.
Well, it's going to be interesting to dive in with you here because, like I said, you're on the front lines, like, well, you always
Mhm.
have, but now with this different version here with TPE administering. How would you describe it to someone if they're first coming across TPE, this concept? How would you describe that to them so they kind of understand it, they get comfortable, and of course, we'll dive in deeper.
Yeah, Dr. Savage coins it well. It is an oil change for the body, and the body is a machine, if we really think about it. And I guess another way that you can describe it's like dialysis. I think a lot of people kind of understand what that is, or even just giving blood. But what we do differently and what I like about it is the machine that we use, the Amicus, the apheresis machine for these plasma exchanges is basically like a failsafe. And I say that because when you talk about dialysis or you talk about even donating blood, like red flags already kind of come up like, oh, how am I really going to feel after this? Ooh, that seems like really excessive, pretty invasive. But really, what it is two needles in the arms, taking the blood out, it spins it. And then, unlike, for example, plasma donation or blood donation, we're giving you back something so that it's not a full draining you of 500 mLs and hey, good luck on your own. Here's some crackers. It's more of let's clean you out. Let's replace it with something called albumin and just kind of help with your blood volume there. My machine, I always tell people when they come in, like it's loud, it's going to yell at me, beep at me, but really that's just either for me to change an albumin bottle or if you just need to fold your arm out more. There are some things that may occur, but really it would be like lightheadedness, feeling faint, and that's just because we're pulling out some of the fluid. But me and the other nurses, we do a great job preventing those really like kind of smaller level side effects, I guess is the best way to say it. Some other things are like it eats your blood sugar a little bit, but we always ensure, hey, did you eat? Let's check your sugar. We'll give you just some sugar packets. Hey, I know your arms are immobile, but here's a juice with a straw to at least help with that. Other things that we try to do is like at least fill you up with fluid, get you a little bit of normal saline, just help you out a little bit in terms of the fluid aspect. But really, it's individualized. It's not the same for every person. And what I like to describe, at least your first TPE experience, would be more of, hey, it's more of like a consultation and a consultation with you and the machine. I figure out which veins work best for you, which catheters are going to work best for you. How do you react while you're on the TPE? Do you get lightheaded? Okay, perfect. If you get lightheaded, I know next time, here's some blood sugar. And normally, if once I address those concerns, second, third, fourth, fifth TPEs are running smoothly. And that's what I really like about it. And that's what to really expect is, especially on that first time, is I'm going to talk to you. I'm going to be really assessing your arms. I'm going to be really assessing how you feel. And it's always great to come back, especially after that first TPE, and hear somebody say, you wouldn't believe I have so much energy. My brain fog is already going. I can remember some things. Let's just go on to the next. Keep harping on that first TPE, but that's what people are genuinely anxious about and afraid of, which rightfully so. But just to kind of lay it out there, like we really take our time to make it a comfortable experience for you and to meet the goals that you're trying to meet.
So Mitch, I'm curious, like after, if someone understands this, like I'm curious, what's like a surprise that you commonly see that people have? Like, are there some pretty common experiences that, like you mentioned, like the whole like, oh, I feel like not lightheaded or a lot more clear minded? Are there other surprises, I guess, throughout the process that people kind of experience that you've seen?
Yeah, everyone's different. Again, TPE, Dr. Savage and other physicians have talked about this as well as in the podcast. It's not necessarily a cure for things. It works for everybody in a different way. I had one surprise was somebody has something called a uh, a geographic tongue, and it's kind of like where it almost looks like the tongue is really dry and it looks a little cracked.
Yeah.
One day they just came up to me and were like, "Hey, weird. I don't know how if this has anything to do with what we're doing." He was like, "But it was for 2 weeks. I didn't really have that geographical like tongue
Yeah.
how it normally looks like it kind of smoothed out a bit, and I thought that was really interesting. And I always like letting my doctors know like, hey, this is happening over here, or this is happening over there. I've had people who, as we know, rheumatoid arthritis, like some of them, they come in for like a brain protocol, or let's say they come in for immunity protocol, and they're like, my fingers have been moving a lot better. Like I have
Oh,
better dexterity. I was like, oh, well, X, Y, and Z, autoimmune, conventionally past few decades, it's been used for autoimmune disease, so that makes sense.
true.
Again, let me let my doctors know. Um, Other surprises, again, that surprise with the smell too. That's something that everybody had when they had COVID was their smell went away. And it's just so great, like having people come up and be like, hey, like my smell's coming back. Again, everybody's different, but just hearing like these small things, like I'll hear like the bad, like, oh, I was really tired after it, which is normal after the first CPE. We take about 66% of those toxins, and that fluid kind of shifts between the vascular and the out extracellular tissues and everything, so it shifts a lot. But they're like, for 2 weeks, I was able to go to the gym, and I was at the gym for, 4 times the amount I was there. Or, oh,
Wow.
my husband, he's more alert, more awake. We're able to talk. We're able to have a great conversation. So simple things like that. And I always have a cheer and a win for it because there's results that are happening there. I even had somebody say, "Oh, they're able to catch themselves now, like even if they trip or realize that they're kind of slipping up when they're talking." And those are
Yeah.
just like really big things for me. And I always ask my patients whenever they come in, "What's good? What's bad? What do I need to fix?"
That's a good question. I use that for other things too. So,
Right.
and I like that you're communicating back to the doctors as well, just because, so it's kind of like this feedback loop, right? So it's helping other folks in the future.
No, definitely. That way they're also aware, and like I said, Dr. Savage, it's very personable. We're all in the same goal. We're all in the same concept, and that's to provide the best care that we can to have people meet their goals and create a modality that is going to be changing. It's going to be ever changing, especially within the medicine world. So having that strong team and that strong teamwork, and I don't know if you know, but like we're different centers.
Mhm.
So like for example, I'm kind of like I'm here, another nurse is up here, another nurse is here. We have a doctor maybe near this nurse, another doctor that's working in this office. But you would think that those would be barriers, but the communication has been really great. And just being able to get in touch with them. And there's been times where I would call, let's say Dr. Ng just on the phone. Hey, this patient has a question. Yeah, sure, I have time. Like, let's
Nice.
talk. And I think that really resonates with people. And even me as a provider, as a nurse, I'm like, I've never had that before. And it's so refreshing.
And that helps. I mean, that's the whole like kind of network of partners basically with MD Lifespan
Right.
is
Right.
communication.
Exactly.
So everybody's learning together. And
Yeah.
yeah, and that's why we're featuring folks on this podcast to
Yeah.
talk about
Yeah.
their experience. So
Hello, my name is Carrie Stewart, and I did the brain protocol for the MD Lifespan. I was struggling to recall names of couples, and so I shared this with the doctor. That's when he introduced me and said, I think you're ready, and let me explain to you TPE, because this is going to help your memory, your focus, your clarity, and I truly believe you'll be a wonderful candidate for this. I have had 5 TPE protocols, and each time I have improved. And it's not until this last one that I am feeling so back on top of my game. Like my brain fog is gone, I am focused more, I have more clarity. This was life-changing for me, and I feel so much better for it.
I'm curious of because one of the first things you started about was your ultrasound IV skills, and I'm
Yeah.
curious of, I guess, why that's important. Just to talk about that, with this whole procedure, and yeah, anything I guess we should know when it comes to that side of things.
Like I said, a lot of people come in really anxious about it because that's the main part, is it's the IVs and getting access. I know in one of the earlier podcasts, Dr. Savage kind of touched on it a little bit, but he really wanted nurses who are ultrasound IV trained, and even better if they could be what we call VABC certified, which is Vascular Access Board certified, so national certification. That's something actually I think all the nurses currently have. And what that is it kind of helps us dictate the proper veins to utilize. It helps us dictate how can we assess and troubleshoot any issues that may come up. Because during TPE, we're pulling blood. It's not like a normal infusion where we're just pushing things in. Like, oh, you have a vein, there's a tube, like things can go through it. Perfect, done. Call it a day. TPE is more of, okay, let's critically think which vein has the better diameter and what we call a catheter vessel ratio. Normally you want it at least 33%, not even half, like you want it 33%. The reason why and why we take so much time with the ultrasound and ensuring that that's the right vessel is to ensure that the diameter at least meets that 33% so that there's also blood flow going around. Because if we just put in like the same size into the same vein, there's no blood flow going around. Really, you're just going to be sucking in nothing actually.
No
And
vacuum, right? Yeah, it's
yeah, it's like a vacuum,
yeah.
because it's all negative pressure. So having those ultrasound IV skills also allows us to be like, hey, like let's say we're during the TPE, right? I talked about those alarms. One of the things that those alarms could go off for, like a ding ding to let us know, is something called there's a high pressure. Typically what happens is if you have a catheter, let's say it's my pinky, and you have a vessel and it's, so, if the negative pressure is too much, the vessel vein can collapse and kind of like squeeze, almost like a Capri Sun.
Yep.
We just want to make sure that a Capri Sun stays filled. So whether we need to, let's say, slow down how fast it's pulling those the blood out, whether it's we need to reposition the arms, like some of the muscles around the veins aren't constricting it too much. Maybe it's, hey, we just need another tourniquet on. You have the vascularity there. If we put on another tourniquet, maybe it could pool with blood a little bit more. So we're actually also able to assess during the procedure and see what could be going on live time without being like, oh, well, that doesn't work. Let's poke you again. Something that I actually learned from my PIC nursing days from an amazing team that I have here in Orlando I used to work with was the more times that you stick somebody, the body kind of remembers that, and it's going to be even harder to do the next IV.
So is it every time? Do you have to switch locations for each TPE session?
Actually, no. Like if you go pretty well through it after that first stick, you can use the same vein. Like I normally say, hey, that vein works for you. That's what I'm going to use. Because in all reality, that intake is only in your arm for about 2 hours, so it's not causing a lot of damage.
Got it.
For example, if it was in, let's say, during a hospital stay. So 9 times out of 10, you're able just to use the same vein each time. And that way the patient also kind of knows, hey, this is the vein that you used. You did great last time. Like it worked well. Didn't really feel a thing.
Got it.
And that was another thing too, like in the pre-assessments, we really do like our vein choices, see what works best. We can see valves. We can see what we call bifurcations where veins split. I even try to assess and see if I need to use a regular catheter or if I need to use the actual apheresis steel needle, because that can also play a different type of a change. So really, I feel as if that confidence within that machine and that technology kind of calms people down. And I also like pointing like, hey, this is what I'm looking at, as long as people aren't squeamish,
Yeah.
and being like, hey, like this is what I'm looking at, this is what I'm going for. Feel free to watch. I'm confident within it, and I can see where it's going. I can see how it's going to last, etc. And I think once they understand that as a patient, kind of all other anxieties go away, especially after the two needle sticks there. And from there, it's just playing around with the machine. What speed should I do you at? How do I need to give you a glucose tablet? Do I need to give you a Tums to help with calcium? But the ultrasound IV skills is definitely something that is a game changer in this form of work and in this procedure. Because if you don't have a good line, or if you don't have, a good IV, or your vein choice is poor, you're not going to have a good procedure or a successful one.
Yeah, I respect you and anyone in that position of even drawing blood, or because yeah, I've definitely had
Yeah.
some misses. I think we all have, and that
Yeah.
leads to, well, you said like the squeamish type of folks,
Mhm.
and because I know a lot of people who are in that boat. Like, how do you calm those folks down, maybe pre-procedure as you're getting into it?
Again, everybody's different. I like if I know that they're a little bit more anxious about the actual poke, and they'll tell me too, like, oh, like I don't like being stuck. Like you either tell me one, two, three. Some people tell me don't even count at all. We also have something called like a panties. It's almost like a little spray that we can use to help with a little bit of a initial pinch. It's like a cold spray, so it kind of tricks your mind.
Yeah.
But really just any nurse's discretion like that, like, hey, let's talk about it. This is where I'm going. This is I have confidence in it. We'll try it out. At least give me one shot. If I can at least prove my skills, show that I hit it,
Yeah.
then 9 times out of 10, they'll be like, okay, yeah, this isn't as bad as what I thought.
Yes,
I
mate.
have had patients that say, oh, just don't go here, don't go there. Okay, like I'll have a look. And that's why I also like showing them the screen, like, hey, I see it. I'm not feeling like I visually see it. It's a video game. Like I'll just hit it. We'll treat it like that. And even using that terminology, like I just used, hey, it's a video game. That's just my target.
Yeah.
Sometimes they'll calm down from it. They'll see it more as like a kind of fun experience rather than a.
Yeah. Make that the image of this podcast now.
Right.
No, but like the way you're describing it does take the mystery out of it, and I think that's what I'm trying to do here is, take the mystery out of from the patient's perspective. It's yeah, there's a target. It's very logical. You have great tools and awesome training, and everybody's helping each other as well in this process. And the cool thing is what there's a series of these sessions that are happening. Was it between 3 and 5 typically? I think.
Yeah, typically 3 and 5.
Yep.
I like to say on average you'll see more of the 5 range. And that's kind of like what we like to keep. I know on an earlier podcast as well, we talked about, 66% in the first TPE, then another percentage in the second, third, and fourth and fifth. But
Right.
again, it's individualized. It's per the patient. Whether they just want the TPE itself, that's also an option. Do you want an IV bag after? That's another option. And our team does a really good job of saying, hey, this is what we think will work best for you. We'll work around it. We'll make it feasible for you and your own goals again.
Nice.
But normally 3 to 5. I think I only had like one, at least in my line of work, one just regular TPE to try it out. But then they continue on to do further TPEs just because they wanted to try it. And I guess they had a great experience.
That's a
So.
good plan. Yeah. Well, I'm curious with being in Florida, like, do you, and you haven't done this in other states, but I'm curious if there are like regional toxins that you're seeing or any kind of trends, maybe from others that you talk about or talk with. I'm just curious if there's like a regional like consistency of trends or, from the patients that you see when it comes to, I guess what's getting taken out or even the feeling afterwards, the different effects of TB.
Yeah, in terms of toxins, Florida is we're a bed full of golf courses, so
Yeah.
pesticides is definitely one of them. Any toxins that deal with pesticides, anything that comes from aerosol cans, think sunscreen. I mean, we have sun basically year round. Everything from what's in our water, etc. Like that can definitely play a part. In terms of how people actually react to the TPE, I think is again dependent on person.
Yeah.
You can have somebody who comes from Massachusetts or even, let's say, Denmark, for example. Like if somebody comes from Denmark, they have clean water, they have different like filters, systems, etc. But if they're still around like a different type of specific chemical, like they could have higher toxins than me. Like whether I have, 4 to 5 or 6 on the little on the blood test or the urine test, the toxin test to figure out what I exactly have. But region does play a role. Like I said, pesticides is definitely one of them. But really, it's all about getting tested and seeing what you have, what you're around.
Yeah.
You'll be surprised. And one of the things too, I actually have a one of the headquarters for some of the containers that we buy, like the plastic containers.
Yeah.
So
Yeah.
I'm sure there's some plastics, even in the air. And we also have a paper mill kind of down the road a little bit. So I'm sure that's in the air. So there's definitely a bunch of different environmental factors there. But again, it's what we do. What do you do in your home as well? What is your lifestyle like? Because you're always going to have toxins everywhere.
Yeah,
So
you
one of the
can't
things that
escape
we did, yeah, like you can't escape it. But we got rid of all of our plastic containers. We have glass containers now, like simple things like that. Yeah, it's not taking everything. It's not the TPE, but it's at least keeping your toxin levels down.
it.
Like, for example, there's certain chemicals or certain toxins that only last 21 hours in your body. If you can get rid of where those are coming from and change that, then you won't have that specific chemical or toxin going throughout your body as well. And that's what we
Right.
really also try to learn and teach and educate our patients with our different protocols and our plasma exchange is, hey, get rid of this, skillet. Here's a concept here, or all the rage are the Stanley Cups. Like at first I was like, oh, Stanley Cups, another fad. But then when I started this job, I was like, oh yeah, no, get those bottles out of here. I even go to Dunkin' sometimes. I'm like, no, get that out of here before it starts warming up.
I had a whole
So,
podcast with Dr. Fine,
yeah,
who it'll be released somewhere in the future. But yeah, she
yeah,
was talking about just how much stuff is leached from these coffee cups, plastic
yeah,
bottles. It's just ridiculous. We all
yeah.
take
And
it for
then you
granted.
add heat to it, and it's
Uh-huh. It's
everywhere.
the
So.
worst. Mitch, I'm curious of like what happens post TPE? Like, is there testing or like follow-ups that happen that you guys do or that you're aware of? And I guess anything that you kind of see in that phase after procedures?
After every TPE, I try to at least reach out, especially if we had something interesting go on, whether interesting like a lightheadedness or anything. I always try to reach out to them within 24, 48 hours. Hey, how are you feeling? Let me know if you need anything. I'm just a Serbo, which is our charting system, just a message away on there.
Mm.
I'll reach back out to you within 24 hours. Um, and but specifically in terms of testing, like you said, we normally wait at least 6 weeks after your last TPE. And what this does is, I talked about the mobilization of toxins as well. That's about the amount of time that it would take for your body to kind of like relax and let things settle where they are, so that we can get a good idea of where your toxins are after the fact. So really, what you have to look forward to after the TPE in terms of communication is you'll hear from one of us nurses, hey, how are you doing? Even before your next TPE, we'll send you an email or some form of reminder, and just to let us know that we're available for any calls. I've had patients message me the good, hey, I'm feeling really tired. Oh, that's normal after the first CP, and we can talk about it. But again, testing is more after the fact. And we do subjective and objective testing. And what I mean by that is you have objective testing, which is like your lab work, your urine, your blood. Those are things that give you those results. Just flat out, these are the facts. Subjective testing is more of like surveys. So we do questionnaires at the beginning and at the end. Some of them include like a quality of life questionnaire, fatigue scale. And what we're trying to do as well is see, is your quality of life also getting better based off of the TPE? Do you feel you have more energy? Is your fatigue gone? How is your mood? So that's something else that we'll also repeat at the beginning and at the end
Okay.
from there. And that's what makes that plasma exchange so great, and also makes our research behind it well, is, oh, like looking at the full person, not just the physical attributes, but how is your, your sense of self? How's your mental, how's your holistic, your spiritual, and
Hmm.
like how are you doing as a person? That's also something that you can see after. In terms of signs, symptoms, what you might feel during the TPE, like I said, you might feel a little lightheaded. A lot of times that's just, here's a glucose tablet, could be your sugar. You might get tingling in your face. That just lets us know you just need a little bit of calcium. Whether we give you Tums or we put it in the albumin bottle before we hang it, that way it goes back into your system. But definitely after first, second, third, you'll feel at least a little fatigued after it. It's okay, take a nap. I mean, your body literally went through a whole cleansing.
Right. Yeah.
Um, and especially with that fluid shift and that mobilization of the toxins out of the tissues to prepare for the next one, you might feel a little groggy, and that's normal.
Got it.
Um, so I like to let people know that as well. Like, you will feel tired, especially at the first one, because we're taking these toxins, whether they've been in you for hours, days, weeks, years,
Mm.
and we're actually getting rid of them. Now your body's like, oh, Well, now I have to kind of reset, figure
Yeah.
out if there's things I can actually focus on as we decrease your inflammation and as we decrease your oxidative stress.
I mean, there's so many shifts happening all at once
Yeah,
in a
yeah,
short period of time, but I know it's spaced out, what, about a month between procedures, right? So
yep,
gives a
yep,
little time for the body to circulate and yeah.
exactly. And like I said, you'll normally see those changes. I would like to say 48 hours after, because 24 hours after, typically your plasma will regenerate itself, whether from hydration and the electrolytes, which can help your plasma regenerate. Which we do give vitamin bags as well at the end of the session, so you're not as like depleted, I guess, or as tired, for a lack of a better term, because the TPE does take out some of those electrolytes, but we would like to replace them. And then help with what we call a performance IV, and even give you some of those good amino acids, give you some of those good zinc and those immunity raising vitamins like vitamin C we give, and it really helps out people's immunity. I actually had a patient who told me, she was like, like I think it was second or third TPE. She said, everybody in my family is kind of sick. She's like, I never got anything. And I was like, oh, wow. I was like, I mean, it could be because of the extra electrolytes. It could be because we're rebooting and helping your immune system, getting rid of those inflammatory markers and those oxidative stress to help out. So, like, hearing those things is really great. Like, going back to your question, it's normally like just mainly like a fatigue that you'll feel after it. Some people, they might not even have it. I have one guy that goes out and runs or goes to the gym right after, which I don't suggest doing, but he does. He's like, yeah, I felt great. I just went. I said, okay, cool. But just let me know.
Yeah, yeah.
Um,
That's what I've heard from everyone else who I've chatted about with or folks
yeah,
administering. Yeah, and that's pretty common. But
yeah.
I guess just to wrap it up, like I guess what excites you for what's to come with TPE? Because it is so new. You're only 6 months in. Yeah, I don't know, anything top of mind? Because the more that I like to ask this because I feel like at the end of these
Mhm.
conversations, typically it's like, whoa, there's a lot of toxins everywhere. What the heck do I do
Yeah,
about all this? But like, there's got to be
right.
some hope to it. And obviously you're talking about the actual way to cleanse. So I felt like it's a very hopeful conversation. But where do you see the
Yeah,
future going
no,
with it?
definitely.
Yeah.
TPE, I guess just that's the exciting part about it. We're utilizing it in a way to get rid of these forever chemicals and these toxins that have been in our bodies for so long. And Dr. Savage said it well, like we need to be educated on toxins. TPE itself, it is fairly new and it's not for everyone in terms of whatever that may be. But there's still ways that you can help, and you can help yourself and keep away from these toxins just to create a healthier environment and a healthier life for yourself. A lot of that is what you consume, what you do. You visit our website. We have a bunch of learning tools and education materials. Go ahead and do a consultation. Talk about it. We don't mind. Like I talk to me, so I do some of the consultations sometimes. Talk to Dr. Ng, Dr. Savage, all of our amazing team. And it's just a quick phone call away just to discuss, hey, I have this one question, or hey, I was subjected to a mold. Like, how can I help with that? And really, that's just what excites me about it is the education, the research that they're putting into it, and just being a part of a company that everybody's excited for,
Yeah.
and the prospects. And of course, the just what I've been seeing on my end and what patients have told me how they feel. A lot of that is just that's really exciting for me, and just to continue pushing forward and seeing really, in a sense, results rather than just, hey, try it out. No, it didn't work, you know.
Yep.
So that's what really excites me about it.
You're doing great things, man, and I'm happy. Yeah, yeah.
Yes.
You've seen from the ER side of things, and that's
Mhm.
you were helping folks there, but now this is like a whole new way, and I
Yeah.
know you're not. There's going to be many others that are like yourself who are helping others as well. So we'll keep doing the
Yeah. Yeah.
education on our side of the podcast. I know you are
There
too.
you go.
So I'm
Yeah,
excited.
which has been great. You've
Cool,
been
man.
doing great with it. So,
Thank you. Well, thank
yeah.
you, Mitch, and
Yeah.
yeah, maybe I'll go join you for a TV session. It's a little far from
Yeah,
San
come on down. Come on down. World of the mouse.
There you go. I love it.
Universal.
I bring the kids for that one though.
Yeah, there you go.
All right, man. Well, have a good
All
one.
right.
Thank you, Mitch.
Thank you. You do the same, Joe. Have a
Thank
good
you.
one.